Everyone coming out for our mental health workshop. We do have a couple speakers here today that are located in Denver, and I'm going to let them introduce themselves, but they have a lot of experience in this field. So Jenessa will take it away.
Yeah, hi everyone. I'm Jenessa. I work with Rick for the City and County of Denver, the Department of Public Health and Environment. I work with the Denver Strong program. And yeah, I guess Rick, you can introduce yourself.
Great. Thanks, Jenessa. Okay, I'll jump right in. I'm Rick Padilla. I, as Jenessa said, work for the city of Denver. Most of my career has been on the affordable housing side, doing national, state, and local policy work and in financing, that type of thing. I got into that when I graduated law school, but prior to going to law school, I had human service background. I used to investigate child abuse and neglect. I started a juvenile diversion program for first-time offending kids to keep them out of the court system. And I used to work for a large foundation called the Menninger Foundation, which the aspect that I worked on, they had an acronym called the Charlie Network, and that stood for Children Have All Rights, Legal and Educational. And that's what I did an undergrad school and post undergrad school, and then I went to law school about 4 or 5 years later and got into the affordable housing, and done a lot of work and sat on a lot of boards. And I won't bore you with all of that, but I'm really happy that Alec reached out to us and excited to share really how I came into what I'm doing today after being an affordable housing guy for over 20 years.
Great. I can get started then. I don't have slides or anything, so I'm going to talk at you all and then we can do questions afterwards. So just a little bit of background for me. I did send the bio over and I'm sure you've read that, but I went to Western Washington University and got a BS degree in community health and a minor in psychology. I then worked for a few years. I first worked for Shared Here Mobile Technology, which is a digital health company, and they focus on virtual directly observed therapy. And it's really, really cool. I first interned with them and then I started working part-time for them. And I was really interested in digital health because my main focus, I guess since I was 18, was I really wanted to focus on global health and decreasing health disparities. And I know that digital health is a big way to do that. And then I moved on to Seattle Cancer Care Alliance. I actually thought I wanted to work clinically, quickly found out that I didn't want to do that anymore, but that's okay, because I did learn a lot from just working at Seattle Cancer Care Alliance. I learned how to be organized, I learned how to work with people and especially difficult people, and it was just really good for my professional growth. And because I didn't get into a field that I wanted to, either because the pay wasn't as good as Seattle Cancer Care Alliance, or because I wasn't qualified, I decided to volunteer. So I volunteered with a local refugee organization there, just to boost up my resume a little bit and gain more experience in that area. I then went to Imperial College London, where I got my MPH, and I did the global health stream, no surprise there. And I learned a lot there. My undergrad was really based off of MPH programs. That's how the person who designed it, that's what she did. And so I wanted to get a different perspective and wanted to learn more about public health outside of the US. And so that's why I decided to go to the UK. And it was a 1-year program, so that was a plus. I didn't have to repeat a lot of what I already learned in my 4 years of undergrad. And yeah, I learned a ton. I ended up not accidentally, but I ended up going to the hospital my first week there. And then I got to walk away without paying anything, even though I was there for 24 hours and did lots of tests. So universal healthcare, we have a lot to learn in the US. Yeah, and then after that, I am now where I'm at now, Denver Strong. It is a mental health training program. I wasn't sure if I wanted to get into mental health because I had just a lot of personal, like me personally, and a lot of people around me dealing with mental health. So I was I don't know if that was going to be too close to home, but it turned out that I really love it. And I really love working at a community level. I think that's something that I've always been passionate about is, being on the ground, working with community members, working with community organizations. And yeah, that's what I get to do with Denver Strong. And I can actually show a bit of our website and just go through what we do. I don't know if I can share. Oh, okay. It doesn't look like it can share. Okay, now it can. Perfect. So we work with lots of different community organizations throughout Denver, just because we don't want to take over and monopolize all the trainings. So if there's already training out there, there's already trainers out there, we just want to fund them and connect with them to do that. So a couple of our trainings, trauma-informed practice, this is a very long training, but it's very necessary. So all of our trainings, most of them, organizations will come to us and ask us to train their whole organization, which is really great because and it's cost free. So that's also really, really great. So the trauma-informed practice training, it's a bit about how trauma can impact like current behaviors and how we can deal with that. And it kind of just helps you empathize a little bit more with the people you're dealing with, which is really great. And then it also goes into how, I guess how to deal with persons that have dealt with trauma in the past and they're now expressing it. Organizational wellness. Oops. This is a training mostly for leadership. And so it's about how COVID-19 can disrupt a lot of different organizations and how to deal with the disruptions and how leaders and organizations can, deal with that. Mental health first aid. This one is a training that's pretty widely known in the mental health field. It's an 8-hour training. You have to be certified to do the training, go through several classes to do it. And then for the training itself, there's a lot of work that you have to do beforehand and even some afterwards. So they really get it in you. And then QPR is a 1-hour training. You also have to be certified to do this training. And this is for suicide prevention. So we've actually had this trainer come in and do work for our other program, We Got This, which Rick will talk about mainly. And it focuses on the acronym QPR. So question, persuade, and refer. Understanding de-escalation, that is a 2-hour training. And this one is sort of like a mini training for the trauma-informed practice. But this one is just shorter and a bit more accessible to those who are really busy. And this one is really great. I hope that everyone at some point will take this training because it's applicable to anyone. And then we have bringing the protective factors framework to your life in your work. And this is a 6-course training, 2 hours each. So you do have to go through all the trainings to complete it. And this is mostly for the child welfare program. And so is the Wellness Recovery Action Plan. And this one's 7 courses and 2 hours each. And then we also started a couple other trainings. I'm hoping to bring in trainings in different languages. So the top 5 languages spoken in Colorado, we're starting with Spanish, and we're partnering with someone now to trying to figure out how we can bring that, because right now we have translators, but we really want to get something, you know, in Spanish, in their language, and something that's appropriate to them. So we're hoping to do focus groups, figure out what is needed. And then we also just did another understanding de-escalation. We partnered with Gentle Way Institute, and this one is more culturally appropriate for a specific target group. And then they also helps you understand de-escalation physically. So the trainer, I don't know what it was. I think like Taekwondo, he started, like he has like a black belt in, and it's not, you know, it's not fighting someone. It's about how to deal with someone who's physically, who's physically fighting you, I guess, and how to de-escalate that in that way. Yeah, and then, I guess I was going to show also what other things that we provide. Let me share my screen again. So our division, the behavioral health strategies, we have lots of different organizations and programs for our community. So you can see here all the ones that we have: Denver Strong Violence Mind, the Overdose Prevention Behavioral Health Solution Center, Road to Wellness and Empower Denver, Substance Misuse, Suicide Prevention, which Rick will talk about a bit more. The STAR program, I was involved with at the very beginning. The beginning when I started, and that this is a great program. It was community led, and it's about how to bring emergency response teams instead of the police, just because sometimes the police aren't trained for what is necessary. We have the Wellness Whitney, Denver Recast, and then the opioid and behavioral health needs assessment as well. Yeah, and what I really like about working with the Department of Public Health and Environment, my dissertation was basically on anarchy. It was about mutual aid. And so working for the government for me was a bit surprising, but I quickly realized that everyone in the department were very like-minded in the way that we really want to serve our community, and things that I like in our conversations and whatnot. I found that that's what we really focus on, is serving the community. We don't even use like words like empower, which kind of irks me a little bit, but I realize that it kind of irks everyone a little bit, which is really great, because we don't want to have the power to give to people. We want everyone, to work together. So yeah, so that's all I have. Rick, do you want to talk about We Got This?
Sure. I'll talk about that. I'd like to ask if everybody that's on, we don't have to go through introductions, but would be really helpful for us is just put in the chat what city you're in, because part of what I'm going to talk about is going to have some relevance to where you're at geographically. So if you wouldn't mind just putting in the chat, like your name in Chicago, Denver, wherever it might, not where you're at currently. Like I know Alec was in Salt Lake now, and I think last week you were in Minnesota. So just really kind of where your home base is. I believe your college is in Chicago. Is that correct, Alec?
So yeah, it's in Illinois. The main center is in like Lisle, which is outside of Chicago.
Okay. I actually taught for 10 years at a Jesuit school, Regis University. I taught Masters in Nonprofit. Taught a course with two other lawyers about nonprofits, how to form them, how to audit them, that kind of good stuff. But what I want to do, and I'm not sure who has a slide that you have put out there, but if whoever that board member is, if they can you just let me know who it is so I know who I'm talking to?
Yep. So Arcano is gonna share his screen, and then he'll be able to pull up the article and video.
Okay, so great. Thank you again for having us. And, what Jenessa just shared with you is just a fraction of the Denver Department of Public Health and Environment. We actually have over 350 plus employees. We are on the behavioral health team, which there are about 58 of us. And if you look at the range of skill sets and educational backgrounds, it's really pretty interesting. We had a staff retreat where they had people that had MPHs on one side of the room and everybody else on the other side of the room. And it was really pretty interesting. It's about an even split. And I think public health in of itself is really growing as a profession in terms of opportunities and what you can do with an MPH. And I think what Jessica or Jenessa has talked about, I think is illustrative of that. And I have to say, before I jump into my piece, that Jenessa coming on board with the city has she's a rock star in my mind. She's a great partner for me because I used to be the housing director for the city of Denver. And my whole life changed on February 14th of 2019. We lost our 15-year-old son, Jack, to suicide. And Jack was a very popular young man. And so very popular young man. A lot of his friends came to our house and said, we need to do something. But we also had a lot of community support from the media and the work that we were doing. And what I'd like to do is just share, there's been multiple news stories about it. Actually, last night, the high school that our boys went to, Cherry Creek High School, very large high school, 4,000 students. It's a very large high school, very strong academically, very strong in terms of athletics, but it's also one of those, I don't know how many of you went to a large high school, but it can be very challenging for kids that don't necessarily fit in those first two categories. And last night, they just ran a news story. When our son died in 2019, they lost 5 other kids in a 6-month period from that same district to suicide. And that caused some real fundamental changes in our community. Suicide obviously is catastrophic for a family, but it can be for a community as well. And what I wanted to kind of know, what's always important to me, when I left the city after Jack died and had to figure out, it was shocking, like you might well expect. I left, the kids came together, they call themselves Jack Strong. They came up with 11 things they wanted to accomplish. And I'll get into what those are, but this is just I always talk about my son. When I came back to the city, they asked me what I wanted my title to be. I said, Jack's dead. That's who I am. I'm a father. They said, well, you can't use that. So they came up with some governmental title, which is okay. That's not who I identify myself with. This particular job for me is not a job. It's if any of you recall when President Biden did his acceptance speech for the nomination, he talked about when he lost his wife and young child at a very early age to an auto accident, and later on in life he lost his son to brain cancer. But one of the things that he said in that acceptance speech was that gave him purpose in life. So I don't look at this as a job to me at all. This is my purpose, what I need to do. But let me share just if you would, what that news story on Channel 9, if you just shared so you can get to know who my son was. Of course, a commercial. And I'm hoping the audio works. We don't even hear the commercial, but you may want to test your audio.
Or can you just make sure you're sharing your computer sound too? There's an option, maybe there's 3 dots or, yep. Try settings. I think you have to be sharing. Go to audio, yeah. Select audio. Okay, I think you have to have a share on, and then you can see the setting that says share computer sound. So go ahead and share your screen again. And then, yeah, I can't see your screen anymore, but you should have an option that says share computer sound.
And as you're doing that, certainly don't get nervous. We all live the life of virtual meetings, and what always happens is the technology side of things.
Yeah,
So we'll get
yeah,
it figured out.
we'll get it figured out.
In the meantime, I did have a question for Jenessa that we can cycle back to
Sure.
while we get these technical difficulties figured out. How has the resource allocation for all those different programs kind of changed and evolved throughout the pandemic, and how has that influenced its implementation?
Yeah, so I started about a year ago. And so it was a bit more post-pandemic for me. But from what I've heard, we did do all of the trainings in person, and now they're almost exclusively over Zoom. And I think that there has also been an increase with that, because it is a bit more accessible. And I think with the the decrease of mental health, that's something that everyone saw is needed for their organization and for their teams. And so now we don't, yeah, I was telling our communications team that we don't actually ever promote it. I just get emails daily and calls daily about people wanting trainings. And so I guess it's just word of mouth, and our Google works really well. Sometimes we'll get people from out of state. Yeah, so I think that it's definitely opened people's eyes to the needs of these trainings.
Yeah, and I would add to that something that's been, I think, unprecedented for this department in our division is we just got allocated $20 million to focus on behavioral health. And that's very significant. We hadn't seen that. So, typically in the past, we've had to go after CDC grants and other grants, and we'd get money out of the general fund for sure. That was always a smaller portion of what we were doing. So we, as Jenessa put on her screen, the behavioral health needs assessment. We have just completed that needs assessment around a strategic planning process. We have that, and that's going to drive where we allocate our resources in that 20 million to address behavioral health needs in our community. So it's fairly significant when we all read about behavioral health and mental health needs and post-pandemic, and particularly in certainly the area that I work in with youth. There's just a surge in suicide attempts, hospitalizations and deaths. And unfortunately, what we're seeing in Colorado is lack of bed space for intensive outreach programs for kids. That's a real significant issue for our community. I was just reading an article that Health One just opened up their 6th youth teen behavioral health freestanding facility, as I was mentioning earlier, the district that I work in. They just last night on a news story, they just decided after we lost our son and these other kids, and in 2019 and 2020, they went to the electorate and got a bond issue that they are building a freestanding mental health facility for kids in the district. So Colorado is really kind of forward thinking. I think the city of Denver is very forward thinking about wanting to address the behavioral health needs of our community.
I can also share the video.
Oh,
I have it
okay.
now. Oops, sorry, 1 second.
Which one are you pulling up, Jenessa?
The channel 9.
Okay.
Does that work?
Yeah.
Okay. Can you hear it?
No.
Okay, one second. Okay, here we go. Share sound.
Shop for all of your automotive needs. New tires,
Sorry.
oil
There's the
changes,
commercials.
tune-up,
Yeah.
or millions of auto parts. Service and maintain your car and shop on Havana Street.
And everyone, your neighbor, your friend, the person behind you, we are all in this together.
There comes a time when you reach a breaking point.
There are some people that are too scared to actually go out and reach out.
For some students at Cherry Creek High School, that point is now.
People are struggling with these things now, and we need to recognize them now.
They're asking for a different approach from the district.
There's not a class really focusing on how to deal with mental illness.
More mental health professionals.
There have been suicides around our community since the beginning of the year, and it has been really hurting us.
And kindness from one another.
There was a lot of really hurtful things that were said to my little brother.
John Padilla graduated from Cherry Creek 2 years before his brother took his own life.
It's a little hard. I never expected to be an only child, and my parents are now empty nesters.
A large part of what keeps them going is Jack Strong, a group they helped create in Jack's honor to prevent suicide.
It's really difficult to get up out of bed every morning, but the one thing that keeps us going is Jack Strong.
Cherry Creek School District supports the efforts of the students and planned a whole school activity around suicide prevention. But junior Meg Wyman
I've struggled with mental illness for a lot of my life.
says the school needs to change their focus.
And it's not just about having a kumbaya ceremony.
She suggests starting with more counselors.
If you walk into the counseling office and your counselor is busy, they'll be like, yeah, come back tomorrow.
During times of crisis, the district brings in more mental health workers to help. There is an upside to this breaking point for these students. Now they're united, aware, and willing to help be a part of the change. Sonia Gutierrez, 9 News.
Cherry Creek High School says they have 15 mental health professionals for 3,800 students, and the district says they did not receive any reports of bullying until after Jack's death. The reports they've received since they have passed on to Greenwood Village Police.
Shop conveniently and also support local on
Jenessa.
Havana Street. With
Do you want me to share the We Got This video?
Yeah, let me tee it up a little bit and then we can share that. I just want to kind of tee it up from that. Then we'll share the video. So all those kids, they walked out of school. They organized that and they walked out that day and they pulled together after that and came to our house. They came up with 11 things that they wanted to accomplish. And that ranged from, they've done with the Colorado Film Commission, the State Attorney General's office, and a media company. They put together public service announcements. We interviewed 40 kids. And these kids, their experiences range from suicide attempts, hospitalizations, deaths by friends like Jack, murder, suicide. They came out and decided we needed to reach teens, and you can find it on YouTube. It's called Teens and Number 2 to Teens, Teens to Teens. They did that. They did a clothing line, but it was T-shirts like they were wearing. So that was their clothing line. But they came up with 11 things in our basement that they wanted to accomplish. Really, I looked at, and the mayor, I asked if I wanted to come back to the city. I said, can't do housing anymore. That's not my purpose in life. So I was fortunate in that I interviewed with our safety department and public health, and the executive director of public health and I just really connected for a number of reasons. So came in, I was very fortunate to bring in some of those ideas that these young people had come forward with that they hadn't accomplished already. And I strictly then, and still do, look at my role as strictly the infrastructure to what they want to accomplish, find the resources behind that and make it happen. And they did just a number of things. Both my sons were lacrosse players. They started a summer lacrosse team. They did, the governor issued a proclamation declaring February 14th, Jack Padilla Day. Last year, the governor signed a law called Jack and Kate's Law around anti-bullying. And Jack that was an interesting aspect for me. We didn't know about the bullying. He was a lacrosse goalie since he was 5. He was, he could handle his own, but we found some really disturbing things when we cracked his phone, death threats and some other things. And I had to push the police department extremely hard to do a criminal investigation. And after 3 months, they completed the investigation. 600 pieces of evidence later, they wrote up their report. I met with the district attorney. They said they didn't find any criminal culpability. My response was, I respect the process. I don't like the outcome. I'll do something legislatively. That's where Jack and Kate's law came into play. And then when I came back to the city about 6 or 8 months later, and one of the things that we did, we really wanted to, again, after doing focus groups with young people, really trying to figure out what did they want to talk about? What did they care about in terms of mental health? So we worked with different hospitals out here and clinicians from those hospitals, from Children's Hospital Health One, Centura, Denver Health. And what we did was we identified 27 behavioral health categories, and our staff, one of the data scientists on our staff, she put together really a great survey. And what we wanted to do was to interview young people about what they're interested in on these categories. So we asked them to rank them high, medium, or low in terms of their interest. And we worked with the state suicide prevention office because we wanted to push this out statewide. So we budgeted $5 gift cards, hoping to get 500 responses. We let it out September 1st of, lose track with COVID. I think it was 2020 or 2021. And we had to close it out in 10 days. We had 2,400 responses from teens and young adults across the state. We filtered out those above the age of 24, did a factor analysis, identified 3 major categories and subcategories underneath that. Then we went out and recruited 12 students under the age of 18 and 3 college-age students and said, okay, here's what you and your peers have said you want to learn more about. Write up what a breakout session would look like. And they did that. And we've used that as the basis for a lot of the work that Jenessa and I are doing right now. And what we did in the focus group, so I asked the question, do you want to do a summit? Do you want to do a conference? They said, yeah, but we don't want adults telling us what the problems are and what the solutions are. We got this. So that's where we use that tag of we got this for everything that we're doing around suicide prevention right now. We also, with the suicide prevention work that we're doing, we got this seminars in schools, and we did our first youth summit last year. We have another one we're going to do on October 6th of this year. And Jenessa, she'll show the video. Jenessa, I'm going to ask you if you wouldn't mind, after we show the video, just telling them what the day typically looks like, because you're the brainchild behind getting that done. So if you wouldn't mind, the city of Denver has a television station, so they do a lot of videotaping for us and run that. And we had them do this film clip that Jenessa is going to share with you from our first summit. We also hired a writer that we wanted to document this journey for other communities to use. So we have like a 12-page that kind of accompanies this video. The other thing that I'll say is we also did an event last October. Part of what I've really heard, and you guys have heard this before, people want to say that social media platforms are the demise of young people, and that's why we have high rates of suicide, homicides. I thought to myself, we have to have a deeper conversation. So Jenessa and I worked on what we call Teens and Screens last October, where we asked Senator Hickenlooper, who had proposed some legislation federally with Senator Blumenthal and others around youth mental health. So he did 2 minutes on just kind of sharing with the audience what that looked like, that legislation. I should say that the audience was not students. We intentionally went after policymakers, people that controlled the purse strings and set the policy. We went after them, boards of education, local and state lawmakers, clinicians, and as well as superintendents and boards of education. We had about 200 people there. So Senator, we did that. We also looked at, if you haven't seen them, you may want to think about looking at, there's 3 documentaries that are out there. The Social Dilemma, that these all deal with youth and the use of social media. Social Dilemma, Ken Burns' latest film, Hiding in Plain Sight, in Childhood, and the third one, Childhood 2.0, which we helped produce with a tech company out of Atlanta. We went through that with the filmmaker. He looked screen by screen, came up with the 22-minute, what they call a sizzle film. We showed that, and it's really the youth sharing their voice on the use of social media. And then we had a panel discussion with a couple of tech executives and mental health clinicians and school psychologists, the medical director for Aetna Health and others. And then we closed. We also had the Institute's Medical Center. They had just completed a 2-year study on youth use of social media, and they had young people interviewing teens and young adults. And so they gave us the summary results on that. And we closed it out with 2 young ladies that we know that came up and shared their experience. One who had attempted suicide the first time when she was 12 years old. And she talked about that in her journey. She's one of the Jack Strong kids. And another young lady that came up that's a junior in college, who at the high school, which is south of the district, in the school is south of where we're at here, that they lost several kids in a much smaller high school when she was a junior in high school. And she started a nonprofit where she asked youth and others to put down their use of social media through the month of November. That's when they lost a rash of kids in that particular district. So we've really kind of really trying to grow this programming, but we got this, the Youth Summit, and in this video that Jenessa is going to share with you, and then kind of talk about the structure of how we really want to get at and hear the youth voice so that we can create programming around that. So this is the video, Jenessa, if you wouldn't mind, on the We Got This Summit.
Yeah, give me a sec.
Be responsible, you're exceptional. Never give up on yourself, the world deserves to know who you are, who you are, who you are.
The We Got This Summit really germinated about 3 years ago. We lost our 15-year-old son, Jack, to suicide. And after Jack died, about a dozen kids came over to our house and they said, "Mr. Padilla, we need to do something." I asked them, "What would you like to do?" They said, "We'd like to do a summit about kids, for kids." We got this, everybody. And the We Got This Summit is really focused on youth mental health and suicide prevention.
One of the biggest motivations behind all this was Colorado's suicide rate. It is one of the highest in the country, unfortunately, and it's the leading cause of death for teenagers all the way up to ages 26.
When I say we got, you say this. We got.
We really want them to see that there's hope, that there are people fighting for them, and that there's a platform here for them to share their stories. Right there is the power of community. These people are your community.
Bridging gaps, open doors, share my resources. Handle business, build genuine connection. We will save one another with our contribution. Yeah.
I definitely lost a couple friends. They lost their battle to depression. So we were visiting middle schools, high schools. We even took a trip to Brush, Colorado, where they had 7 suicides in 1 week. So hearing these stories is, heartbreaking, devastating, and, whatever we can do in our power to try to help and save some of these people's lives, we're willing to do that.
Events like this normalize the conversation. They give the kids the strength and the language they need to be able to speak and advocate. And then there's that education piece of, I know what to look for within myself. I know what to look for within my peers. It's not stigmatized. There's not a big deal. It's just come to school and hang out with your friends and go to some fun workshops and learn about stuff. This is exactly how we do it.
What I'm here today is to be able to inspire young people to live, dream, and succeed in a whole new paradigm of proactivity and possibility, so they can see what's working instead of what isn't. Up toward all your greatest dreams coming true. And the tradition is I take the spark from my heart, and on the count of 3, you know what to do? 1, 2, 3, bing! Ha! Make it a hug. So that kids will know the value of who they are, what they do, and the difference they make. And I will be making sure everybody gets honored with a blue ribbon that says who I am makes a difference.
I'd like kids to come away with this sense of empowerment that sometimes the solution might be in their hands and their ability to finally open up and to speak what's on their mind, and or to take that opportunity to go look for that help that's out there, just waiting for you to walk in the door or make that phone call.
Let's make it rain and thunder at the same time. Rain and thunder.
This event was fun. I wasn't expecting it to be like this at all.
The people here were really engaging. They were really kind. I liked their vibes. They were really pretty cool.
I've realized that I'm not the only one, and it shows that there are now more people and no more ways to get help.
I think it was very insightful, and I just feel more educated about how to approach the topic and how to converse with other people and help them if they ever need help.
I know personally for me it's been difficult, so to have something like this and to have our teachers just showing us that they care for our mental health and that we have someone there is good.
I lost my son to suicide in October 2018. He was a sophomore in high school, and I now run a nonprofit to bring the youth's voice to the table.
Most hands are up, yeah.
I want kids to know that it's okay to not be okay, that it's really important to ask for help, that they aren't alone, that their voice is heard.
I really like that one quote from Robbie's Foundation. It's like, hold on, pain ends. She also mentioned that suicide is like a permanent solution to a temporary problem, so I feel like that would really get people to open their mind up a little bit.
I want adults to ask the questions, and I always say 2 ears, 1 mouth. Listen twice as much as you talk.
I truly believe these events need to happen more often. I think these should be a part of a curriculum, and not only just as a special event, but for all ages. And when schools and districts start to realize that these events are what is going to empower young people to walk away from the school and be equipped to deal with day-to-day, as well as they are with math, as well as they are with English, foreign language, this is important. Because to survive our society today, they first must be able to survive themselves.
We need to instill hope in them that they do have a future, that they're not the lost generation.
We're missing out if we can't talk about this. It's time. It's very, very much time. Don't wait until there is a death. Work on the side of prevention.
I'm 80 years young, and at any age we can change the world 1 minute at a time and give a chance for the kids to be able to make the world a healthier, happier place for all people.
1, 2, 3. You're exceptional. Never give up on yourself. The world deserves to know who you are, who you are, who you are.
Sorry, I'm just gonna make sure that's not gonna play again. Yes, so, do you want me to go over?
Yeah, let me just tee it up, and then I'd like you to kind of talk about how we structure this. And so we're really taking, when we talk about public health, think outside of the box. You got, you're young, you're smart, bring those ideas to the table. We're failing our kids, and it's time that we have to empower you and give you the strength as young leaders coming up to really make some fundamental changes around this. And that's just one example. And Jenessa just does a tremendous job as we organize these events at high schools. We're now moving into middle schools as well. So Jenessa, you want to kind of talk about how that's pulled together?
Yeah, so our high school seminars, they're just the mini summits. The summit is annual, but we also go into high schools and middle schools and put on events for them, specifically tailored to those high schools. And so what the day looks like is we all come together in one area, kind of assembly style. We have a musical performance for them, just to get them excited about the day. It's usually a local band. And we also bring in a keynote speaker. And in the past, we've had Jermaine Stafford, who's a former NFL player and an Olympian. And he does a really great job of inspiring the students and get them prepped for the day. And then we also do some data analysis as well. So we do a Kahoot just to gather data on where they're at with their knowledge, beliefs, and attitudes, and then we do one at the end of the day to see if it's changed, and it usually does. And then they go through 3 different breakout sessions. The breakout sessions are 45 minutes each. We partner with I think like 12 different organizations for those breakout sessions. They're all local organizations that are focused on youth. And so the students go through 3 of those. And then, yeah, we end the day with a little giveaway, because sometimes we go into schools where the attendance rate is really low. And when they hear, that they don't have to be in class, that, there's no attendance, then it's a lot lower. So giving them the incentive of gift cards at the end of the day really helps them stick throughout the entire day. And then we also have the band end us out as well. So that's basically what our high school days seminars look like. And our summits are just a larger scale of that. So the summits are, last year we had it at a university campus. This year is the same. And so the students kind of get a feel of what college is kind of like. They get to be on a college campus, which is really exciting for them. And they're moving through like classes. Yeah, so, and it's our summits, it's for anyone in Colorado, basically. So the students from everywhere will join us. And this year we're having some administrators from smaller towns and, like hours and hours away. They can't really bring their students to the summit, but hopefully they can learn something and bring the summit to them. Yeah, anything else, Rick?
No, I think that's a great summary of what we're doing, how we structure it. And again, this all germinated from what young people said and what they want to hear about. And we've been fortunate that we've been able to kind of craft this program as it continues to evolve at the city of Denver. One of the things that, for those of you that live in the Rocky Mountain states, it's now known as the suicide belt. When you look at rates of suicide attempts, deaths, hospitalizations, the Rocky Mountains were higher than, unfortunately, the coastal cities and the plain cities. Don't really know why. I'm sure people much smarter than myself that are really researchers are looking into that phenomena. But what we do know is that post-pandemic and the teachers that we have talked to in the schools, there was these kids that are having to learn how to socialize, social adjustment skills, and the behavioral health and the mental health issues that have really kind of come from the pandemic. If you were in the 7th grade when the pandemic came, now guess what? You haven't been around others for 2 years, and now you're in high school. The trauma that kind of comes with that as well. But that's what we're doing. We really want to engage and answer some questions, engage in a conversation. So I think I'm going to pause there. And Alec, turn it back to you and your team.
Yeah, I thought personally that that summit video was really cool. How you guys are personally catering to the target audience and who you're looking to kind of get a response from and see what works best for them. And it's a different sense of creativity that I think will be effective.
We really decided, thank you for saying that, when we decided early on that we needed to engage the creative community. And like the musicians, the slam poets, they can, all the time, you don't necessarily have to share your story with a clinician. I think therapy is great, and it's something we should all do when we need that and not be ashamed about it, destigmatize that. But, sometimes young people need to learn how to express themselves, whether it's through poetry, through music, through digital media means. And that's why we want the creative community there. And all the creatives that come in are focused on mental health. And that was real important to us as well, because when you're bringing rappers in, you got to be, got to make sure that, the lyrics and stuff fit with what you're trying to accomplish. And all these bands are, and these folks are. So I think, just thinking out of the box and being creative and knowing your audience, for us at the city of Denver now, we're trying to figure out, we bring these to the schools. Okay, so what's next? We know from a workforce development standpoint, like the field all of you are working in, that there's not, when you look at whether it's MSWs, MPHs, psychologists, there's not enough of them in our schools and our communities. So that's a workforce development issue. And the city's really looking at how we can put some resources into that. So, because, sometimes a young person just needs a mentor, somebody that, a trusted adult that they can talk to. And I would say, because you guys as I can tell, I assume that most of you are college age because you're in an MPH program. There may be some others that may fall outside of that 25, 24-year-old age bracket. But in colleges today too, it's a huge issue. That's why we want to make sure, yeah, we're looking at teens, but the young adults, when you start to look at the mental health issues that are emerging post pandemic. And you know what, one thing I would add that's really, we hear about gun violence across the country. In Denver, how we look at youth violence is internal and external, because we have to have, in the internal is suicides, self-harm attempts, the external, the homicides, the assaults, because there's a behavioral health, mental health aspect to a lot of those things that are happening. And so we really try to look at it from that lens in trying to address our community needs. And we're happy to take some questions. Fire away.
I had a question for you guys. Have any other communities outside of Colorado reached out to you to kind of mimic your program outside of the state?
That's a great question. And we actually, when Jenessa talked about for this upcoming summit, it's open to folks across the state. The philanthropic community has asked that question, hey, because we're using federal rescue dollars, the ARPA dollars, to pilot these programs to see what really resonates so that we can get them into federal fund budget discussions down the road, because that money goes away in 2026. So we have, we're in negotiation with a very large foundation that has asked that question. You know, can you bring in from frontier Colorado, rural Colorado, resort communities that are all experiencing the same thing? Can you bring in the administrators of the mental health folks to see what you're doing that perhaps it can then be replicated in their community? So that's our intent for sure this October.
Yeah, and I also, so Denver Strong is grant funded, and the grant company is a national group. And so I was asked to present on We Got This and the work I've been doing on that. And the writer that we hired that Rick mentioned before, she created a document that is a framework document that makes it just easier to replicate what we're doing. So when I presented that, I got lots of questions about it and how to do it in their own state, in their own county. So yeah, there's definitely some people who are definitely interested in it, and I've shared all my resources with them.
That's awesome. Thank you.
Yeah, I feel like this type of summit situation could be scaled to communities across the country and cater to the values of that community and interests, and kind of get the best out of them and what they really care about. So I think it's a very cool trajectory.
Well, we have to look at, we have to have some paradigm shifts today in how we're addressing mental health. The city of Denver, we're in the evaluation phase of it. We put together an anti-stigma campaign focused on substance misuse and mental health. And we've all seen the campaigns, which I think they're great, where they drive people to resources. We took a different approach to it this time. And it's called What You Say Matters. And it's really what we constructed and put out there on buses and television and radio, really looking at where people are. It could be a gay couple having a conversation. It could be a mother-daughter, father-son, two teens talking, but really wanting people to think about what you say to somebody matters. For example, if you're having a conversation with somebody, and instead of saying, "What's wrong with you?" perhaps we would say, "You look like you know, is there something you want to talk about today? You look like you're struggling a little bit." So really, we wanted to take a different approach to that, but really looking at what you say to folks when they're experiencing some kind of trauma or difficulty in their life really does matter. All right, so I know we can't see everybody else's faces, but you know, I haven't taught college before. I could start asking questions, but I'd much more prefer to see if you guys have any questions that we can answer. And we're certainly happy to share any of our resources with you all as your ambassadors when you graduate and you go out to other communities, our communities you're working in. We're certainly happy to share any of our resources with you.
I have a question. So with going through this process of, I guess, the grieving process of your son and everything, would you say that this helped you grieve through that process, or did you seek outside of outside help for you and your family, as far as therapy or anything like that, or was this program was this your process of getting through that trauma?
Well, still in therapy, and I may be for as long as I need it. So, you know, our particular therapist is an incredible person. Our son was in the hospital for 9 days before he passed, and we're also donors as a family. And so she came in when we had to make some very difficult decisions around that. And we have stayed with her, and she has seen a lot of other kids in our community. So that's, you know, that's certainly, you know, you go through a traumatic event like this, it can give you purpose in life or can destroy you and destroy relationships. And we as a family made a very conscious decision to go public with our story. One, because we wouldn't want hopefully help other kids and families not to experience this, but you know, to elevate the issue. And elevating the issue for me is what I'm singularly focused on, elevating the issue so we can have the conversation. So I think going down this path, creating the We Got This and the school stuff, yeah, that's very therapeutic for me because I can see some of the successes and in terms of young people asking questions, being engaged, and being willing to talk about, because young people are talking about their mental health. I think it's adults in my generation and others that have stigmatized the conversation. So it's been certainly therapeutic for me. I mean, you know, there is compassion fatigue sometimes, and you know, that's just a reality of it. But I get energy from feeling like, you know, I'm accomplishing something.
Thank you.
You're welcome. You know, I can add an interesting byproduct of these efforts that I didn't expect at all. Once you, as a family, join this club that nobody wants to join, there's a lot of, you realize how unfortunately this issue is in our community. But I've had parents now that want to volunteer. They come out to these events and want to volunteer because they find it healing for themselves as well. And it's difficult, but it's, you know, it's a process. You know, it's probably a process for all of us will be a lifelong process. But that's one thing I did not expect at all. So thank you for the question. I do appreciate that.
All right. Any other questions for Rick or Jenessa?
And we know it's what is it, a Thursday night, and it's in the evening, and but you know, if there are not any other questions, that's great. We hope that we've at least shared some ideas in terms of career pathing. Public health can take many different aspects, but it's really you all. And do we have a question in the chat?
Yeah, so it looks like Ariel's asking, what has been the most meaningful success you've had from this program?
Individually or as a city?
She said, whatever you want to share.
Yeah, okay. I think one, from a city standpoint, to the question that was asked earlier, other communities are interested in what we're doing. That's rewarding in and of itself. Maybe we're on the right track here. One, and two, I know we're elevating the conversation. So those are really rewarding things for me in on that side. Personally, I mean, I still have, the anniversary of Jack's death was 2 weeks ago. These kids, he would be a freshman in college this year. Phone calls. Some of the kids came over. We have a tree and a bench dedicated to Jack in a park across from the high school that he played a lot of sports at. They came over. It was bitter cold too. We went and sat at the bench. We went out to dinner. So, and they hear these kids tell their story and saying, because some of these young people really had some trauma in their lives, and to see and get to know them over the last 4 years and see the progress they've made, you're making an impact. So that personally, that has meant a lot for me and my family.
Yeah, I think for me is bringing all these resources to these students. We go to a lot of high schools where they're alternative schools. So like one of the high schools we went to, I think most of them got expelled from their normal high school, so they didn't have anywhere else to go. And we got lots of great feedback from them about how, they're not really seen, and how it was really great that we brought this to them, and they connected a lot with the different organizations and even the band. The band is really, really great. They even went back to the school to give someone a t-shirt that they promised them. And so everyone's just really connected, and these students feel more part of the Denver community than they did before. And I think that's something that I find that's the most meaningful success.
On my end, I'm just going to close with this, because we're not going to, we've been talking for a little over an hour now, and we don't want to make you stay on if you have other things, which I'm sure you do going forward. We appreciate the opportunity, but I would just say I'm a career changer. I mean, I got a master's in city management. I got a law degree, neither of those. I mean, then I went into affordable housing, and now I'm doing this, which I never would have picked this path, but sometimes you don't pick your path picks you. But pursue something with purpose, particularly if you're going to go in the public health field. There's lots of things and a great need for young, bright minds that really care about their community. So I would say, think about that as you pursue careers as you near graduation. And our son, John, who was in the film, he's doing that. He just finished a film on mental health and the suicide industry. I mean, in the ski industry. He's a big skier, backcountry skier. Just did a movie going up to Crested Butte in Colorado here in a couple of weeks. They want to show it up there. And this is somebody that was always dead set on going to medical school. I mean, he got his undergrad degree in neuroscience and cell biology. Now he's getting a master's of science and innovation and management. He did a film, about the ski industry and what's going on in there. And he found that purpose. What he'll do when he graduates, I don't know if he'll do the med school thing, but he's really kind of found this purpose. And I would just say, think about that as you pursue careers. What's satisfying to you, and you'll excel if you do that.
Well, I just want to say thank you to you both for joining us this evening. I know that I've learned a lot from just hearing you guys speak about your experiences and just the work that you're doing. It's inspiring just to know that there are people who are giving a voice to people, specifically to teenagers, to be able to share what they want as opposed to what maybe people who have been maybe doing it for a while think should be done. So I just wanted to say thank you to you both. I really appreciate you guys speaking on your experiences.
Yeah, thanks for having us. This has been lovely.
Yeah, we really appreciate it. It's been a fun hour. It's been very insightful, more than I expected, that's for sure. So thank you.
You're welcome. Ever in Denver, come see us. Come to one of our events with us. We always can use good volunteers. We'll put you to work though.
I would personally love to stay in contact and help out if possible. It seems like a great cause.
Yeah, we'll definitely keep in contact. Our event is October 6th and we need lots of volunteers. So
yeah,
at least for then.
Awesome. That sounds great.